This is a previous patient of ours who's recovering from pneumothorax. She was hit by a car and she had air surrounding the lungs. We're going to listen to her today and find out how she's doing. So for normal heartbeat sounds, you would hear the systole, diastole, and then for the lungs, you would hear hopefully clear, not congested, no wheezing, no hiccups or anything like that. So we're going to go ahead and listen to her. So we're going to listen on the right hand side, so that'll be the tricuspid valve. And I'm going to go ahead and get a pulse on her. So when you do it, you time. And I do it for 15 seconds. And then multiply by 4. So I'm getting 64 as her heart rate. And we're going to turn around and listen to her left hand side. Hi, pretty girl. And on the left hand side, we have the aortic, the pulmonary valve, and the mitral valve. So we're going to listen to all of those on the left hand side, right behind the elbow. She sounds beautiful. So now we're going to check her lungs and make sure there's no crackling or anything like that, since we're going to do the left side first. Okay, everything sounds clear to me, so now we're going to turn around to the right and listen. That's okay. She's such a good candidate. Okay. So on this side, I do hear some crackling still, which would be normal for her case. And hopefully she'll recover well without any more of that. I'm going to demonstrate how to hook up our leads for our ECG machine. We have our patient in right lateral recumbency. We're going to do white on right. And kind of just hook it up underneath the underarm area. We're going to do smoke over fire. And then we're going to use our alcohol as kind of a conductor to get a good connection to the machine, so we can get an accurate reading. Okay. And now we just wait, and it'll take a moment for it to sync up. Our patient has a really pretty EKG. So this first little bump right here is the P wave. Then we have our Q, R, S. And then the next little bump down here is the T wave. So we seem to have a good, strong, consistent heart rate and a pretty regular wavelength. So now I'm just going to print this out for our client and attach it to its paperwork. So this is Remy. Remy is an aggressive rabies suspect. Lola here is going to help me demonstrate how we would handle a rabies suspect. So I have a catch pole with a release on it, and I have a pole with a hook on the end of it, so we don't have to get our hands any closer to an aggressive, like fear biter, or somebody that we think may have rabies, or just a dog that we just don't feel comfortable coming right up to. Okay, so we would use this, and we would stay back and put the loop on the end of the dog, and then we pull as tight as possible. So now we are able to guide our dog, come on buddy, wherever he needs to go. And then when it comes to releasing, we just turn this little knob right here, and it releases it. And most of the time you can just pull it right off, or you can use your wire, one with the hook on the end, just to get, so you don't put your hands close enough to just release it around the neck. bloodstream so that you don't get any bacteria from the prepuce into the urine that we're going to do for testing. I'm going to demonstrate how to thoroughly clean a kennel. Using foam quat, it's a foaming cleaner that gets a bunch of diseases and bacteria and viruses that are associated with veterinary environments. So what you're going to do is you're going to thoroughly spray down your kennel, making sure that you get the bottom, the sides, kind of just briefly spray it, the top of it. And then we're going to also get the door, because that's also important. All the way up, all the way down. Okay. And then you're going to allow it to sit for 10 minutes. And foam quat is amazing because it kind of eats all the dirt away, and all you have to do is simply wipe it out. It's been 10 minutes. It's time to wipe out our kennel. So you're going to start with the top of the kennel. It's very important to get everything. Okay, I'm going to move on to the sides. And the back of the kennel. Now we are going to do the bottom. Seems to be coming up pretty nice. Okay. We're going to get the door and make sure you get the top of it. Insides. And also make sure you get your edges, all your outer edges. And the beauty of these kennels are that the door handles just kind of come right off, and you can take it to the tub and scrub it as much as it needs to be scrubbed, and then put it right back on. I'm going to demonstrate with Dr. Gatlin how to do a male catheter. So I'm going to open up my items for our sterile field, and she's going to go ahead and put on her sterile gloves. Our gauze, we don't really need that much. We have our catheter, which is the appropriate size. Dr. Gatlin's going to get out. And then we have our syringe that we'll use. Okay. And then our sterile lube. This is brand new. So we'll just put some. I'm going to flush the prepuce. So we're going to spray all around it and then go inside and kind of give it a good flush to get all that fluid that's on the outside clean with this chlorhexidine solution. There we go. Okay. So Dr. Gatlin handed me this gauze. I'm gonna push the os penis back, and there we go. Got our tip out. There we go. And she's gonna insert the catheter. It's nice, lubed up and sterile. And sometimes you kind of feel a little bit of pressure when you're going into the os penis.
Yeah, he's a young dog, so it was kind of hard to appropriate the right size, but we're not going to cause any trauma with this one. So then I'm back in here. Let's see, maybe go a little bit further. And voila. Ideally, I'd like to take this out because the first part of the bladder, sometimes you didn't get all the bacteria out with your flush, so you can always just discard that and then go back with some and get a better sample. It's kind of like catching midstream. Okay.
So now we will be able to run our urinary analysis based off of fresh, sterile urine. Our cat here is sedated. We are going to do a cystocentesis, which is drawing urine directly from the bladder. So we have our ultrasound machine set up and our probe. We've already clipped all the hair where we're going to draw the urine from. And we're going to use alcohol as our medium. So we're just going to spray it. This also helps sterilize everything as well, because we want our urine to be as sterile as possible. Okay. So Dr. Gatlin here is going to locate the bladder for us. Okay, right there. So I'm going to insert my needle right in front of the probe from where she has it selected. Here we go. I'm going to insert it right there, looking at the screen to make sure you can see it right there inserted. So go ahead and draw back my urine. It's coming out nice and smooth. You can see it on the ultrasound machine. And then we're just going to pull it out without pulling any more air out of the needle. Put our lid back on and insert it into our red top tube so we can run our SA and UA machine. And demonstrate how to do a Schirmer tear test on a patient that just got neutered. Open my package and I'm going to label it for the right eye. And you want to label it because when you go to do the left and the right, you want to know which one has increased or decreased tear production. You're going to fold your test at the 0 mark. You're going to stick it into the eye at the bottom and then close and start your stopwatch for a minute. Okay, it's been a minute. We're going to take out our test. It looks like it's at the 10 mark. And when you interpret, most of the charts are on here where you can just read it and it tells you normal dry eyes, mild dryness, moderate dryness, and severe dryness. So for a 10, he's at right below normal at dry eyes, but he also was just sedated. On our patient, we do not have a tonopen, but we do have a Shiatz to measure ocular pressure. So Jalen, our assistant, is going to help hold Marshall's eye open, just like so. And he's still a little sedated, a little drowsy, which is perfect. We have already put our proparacaine into the eye, and that kind of takes a few minutes to numb. So it's been time enough. Okay, so we're gonna open his eye and we're gonna set. Okay, so we're gonna set it onto the eye, and it looks like you kind of just balance it. Okay. So it looks like we have a like a 13. So now that we measured, we're going to look at our calibration table for Shiatz tonometry. He was at a 13, which is 16 millimeters of mercury. Anything under 20 is perfect. So I'm going to check and see if my patient has any abnormalities, scratches, punctures, anything on the surface of the eye. We're going to use the fluorescent stain in his eye that we pre-made using the stick. So you're going to just open it and you're going to stick a few drops to cover the surface of the eye like that. Okay. And you're going to use a woods lamp. We'll turn off the light first and then use the woods lamp. And just observe. And if there's anything in the eye, it will glow. Otherwise, it just kind of sinks to the corner of the eye. And I don't see anything. I think he's perfectly healthy. So I'm going to take and wipe off some of this excess. And I'm going to use some saline eye rinse to go ahead and rinse off that eye stain. And wipe it out. I'm going to demonstrate how to express anal glands on my patient. This one was sedated for surgery, so it's a lot easier when they're asleep. I have my lube. I have the most important thing of all, which is smell good spray that you spray after. Most of the time we'll spray it after we do them when they're awake and give them back to their owner, and this sells pretty well. And then we have our baby wipes. They're also important, so it cleans up the mess and helps with their honey. So put some lube down. I'm going to put some on my fingers. We're going to go internal at the 4 o'clock and the 8 o'clock margins, and sometimes you can do it externally, but for this video we're going to do it strictly internally. So you're going to go in, and you're going to feel for the glands, which I didn't want. Okay, I feel one right there. Okay, so we're going to go in, and you're going to pinch, and you're just going to squeeze. So I got some out right there. Put some on my baby wipe. Did one side, and now we're going to go through and get the other gland. You just pinch and you squeeze. So they weren't too awful bad. And then you clean your patient up really well. And then we're just going to give it a good, smell good spray. So I'm going to demonstrate how to do an enema on a patient that is most likely constipated due to not being able to defecate. So if it gets to the extremity where we can't give any oral medications to make them go, we'll have to manually do it by performing an enema. So over here I have my warm water. Go ahead, come on. And you're gonna, we kind of use this metal pan. We'll fill it about halfway. And then we're going to mix a lot of our lube. It's nice and lubricated. So we do about a half and half. Syringe that has a catheter tip on the end of it. I'm going to kind of mix it up. Well, and then draw some up. So we have a nice lubricated fluid. So I'm going to demonstrate how to actually perform a enema because we're just demonstrating. We're not going to be in the bathtub. We're going to insert the catheter tipped syringe into the rectum. You would push the fluid in and you'd probably have to do it multiple times until you were able to get feces to come back out, and the lube helps kind of push all that back out. You would not want to do a pre-filled bag enema on a cat due to electrolyte balances, and it could harm your patient. So this is the best way to do cats. The pre-filled ones can mainly be only used on dogs. We are going to apply this Advantage Multi, which is one of my favorite flea and tick medications. Just take it out of the package, prop it open, you puncture the top of it with the lid. Kind of becomes routine as you do it every day. You're going to separate the hair on the back of the neck so you can get down to the skin, and you're going to apply it on the back of the neck so that the cat cannot lick it off, and then it won't do its purpose. This is a patient of ours that came in. She has ear mites. So I'm going to demonstrate how to clean a cat's ears. I have all my tools set up over here. We have gauze, we have our cotton tip applicators. This is the Dermavet ointment that we'll use afterwards to kind of soothe the irritation from the ear mites. And I'm going to apply an Advantage Multi and use this EpiClean to clean out the ears. Okay, you ready? So we're going to, look how dirty those are. Those ear mites kind of, ain't no party like an ear mite party. So you're gonna put a few drops in there and kind of massage gently at the base of the ear. And if this cat was awake right now, it would feel really nice. A lot of them kind of scratch at their ears. Sometimes it causes a hematoma in the ear. You're gonna take your gauze and kind of clean it out the best you can. It's pretty dirty. So the ear canal is L-shaped. And you can use your cotton tip applicator to make sure not to go down and hit the eardrum. And you're just going to try to get as much of that debris as you can out. Got some of it. Clean this cat's ears into broad. So now I'm going to apply this Dermavet ointment into the base of the ear canal And kind of give it a little squeeze and a good massage, and that right there will help soothe the irritated ear. Spike here has an infected right ear, so we're going to go ahead and clean it and medicate it. I have my EpiClean. I have some cotton tip applicators and some gauze to kind of get it all clean, and then I'm going to treat with Dermavet, and then he has some take-home medication that the owner will treat him with as well. So I'm going to just take the EpiClean, give it a good squirt in there, massage at the base of the ear really well. It kind of loosens up all that gunk and gets it all out, and I bet it feels really good to him. Massage it really good, take our gauze, go in and get a good clean out of it. So we got some nasty dirt on there. I'm sure he really appreciates this. And the ear canal, it's L-shaped, so when you use your cotton tip applicators, you want to make sure that you do not go too far and hit his ear canal, his eardrum. And his ears are not that bad. Okay, and now we're going to treat with Dermavet. Okay, and you're going to make sure to get that all the way, because it has a long tip, all the way at the base of the ear, and then massage it in. This is Stumpy. I'm going to administer subcutaneous fluids to him. I have my lactated drinker set up and my line already put in. I'm going to go ahead and get a brand new sterilized 20 gauge needle. And I'm going to run my line to get any kind of air out. And you can see all the bubbles coming down and coming through, and you don't want to push any air under the skin. That's not the point of what we're doing. So now, we take our needle and stick it under the skin. I know. And then start our fluids. And it's really good to watch where the number is when you first start, and so you know how much fluid to get. Rule of thumb for small dogs is normally like 100 to 200 mils depending on how dehydrated they are. You don't want to give them way too much fluid because that could harm them. So make sure that you give them the appropriate amount of fluids for the size of dog that you're doing. So it looks like he's got a pretty good hump going there. So we'll go ahead and take it out. I'm going to do a nail trim on a cat that we have sedated, and we're going to do some other work too. I have my nail clippers. I have my quick stop that we put into a syringe because it's way easier and more convenient than having to pull the powder out of the container. And then a silver nitrate stick in case I quick. So, got my nail trimmers. You just go and you go ahead and bring it closer. You trim, because there's the quick right there, so you just want to get right above it. And cats are pretty simple. They're a lot harder when they're awake versus when they're asleep. So we're done. This little pup came in severely matted and has the longest toenails that I've ever seen, and I get the satisfaction of getting to cut them. So I'm not sure really where the quick begins or where it ends, but I'm sure it's way down in there. So I have my clippers, and I have some silver nitrate sticks just in case I quick. You can use those, or you can use quick stop powder, and you just put the powder on there until it clots. So there's a few nails down in this. So I'm going to do this one because I can see all the way to the bottom. So I think I'm going to clip a good, like right there. I'm going to start there, and you can clip until it kind of gets a little bit shiny, and then you kind of know it needs to stop. So that seems like a good length. And look at that killer toenail. So for an emergency bandage situation, we're going to use this patient that just had surgery. So she has a spay, and let's say she's like bleeding a lot and we're waiting on the doctor. It's part of the tech's duty to hurry up and put an emergency bandage on. So we'll use some Telfa right here. Open it up, and Telfa is amazing because it won't just stick to the wound. So we'll place it, and then I have some gauze in case our patient is bleeding excessively. So we would put it on stacks of gauze. Then we would vet wrap our patient as fast as we can without putting the patient in any more stress. And you do this a few times. Until it's nice, tight, and snug. And sometimes it helps if you have some pressure there to stop the bleeding. And then you cut with your bandage scissors. So I'm going to demonstrate how to do a modified Robert Jones bandage. I'm going to tear off a couple of pieces of tape. Pretty good size. And we're going to apply our stirrup. And apply our top piece of tape. Press that together. Now we're going to apply our cast padding. Let's start with the bottom. We're going to evenly roll the cast padding onto the fractured leg. Now we are going to apply our clean gauze, and that helps tighten. So we have the basis for a modified bandage, modified Robert Jones bandage done on this cat. So now we would take off the stirrups, put the tape down, and then add the vet wrap onto it, and that would complete it. But we are going to use our splint that we pre-measured. Now we're going to apply our clean gauze. We're going to roll it off and around and tight to keep our splint in place. And this splint fits this cat fairly well, so if you had one that did not fit, most of the time they have options where you can cut and then file down.
That's good.
And now I'm going to undo my stirrups. And do that by untaping. And you're going to twist the bottom and turn it back. And lay it flat against the splint. Same thing with the other side. And then she has a little bit of toe sticking out, and that's perfectly fine. And you want to make sure it's not too tight. Okay, and now I'm going to apply my gauze, my vet wrap. You go up and down or what? Go all the way up.
That's good.
So it's imperative that the owner make sure not to get the splint wet at the bottom, or that the cat has any kind of smells or odors coming from their toes. We will schedule periodic appointments to check the splint and see how it's going, and then probably do bandage changes. So now I'm going to demonstrate how to remove a Robert Jones bandage. So you just start cutting the cast padding and everything. And be careful if it's not ready, like you don't want to refracture the bone. You just cut across. You go all the way down and just start unraveling, unwrapping everything. So that layer we can just remove, or you can just cut it off as well. So I'll probably just do that. There you go. And it also helps if you do have somebody holding for you. So for tape, if the bandage has been on for a long time, you can use Ease Off and spray that on there, and that'll help remove the tape without it off. This is pretty fresh, so we'll just have to remove it. There we go. So on the dental radiograph we just took, there's a little bit of crowding going on, maybe a little bit of root exposure down at the bottom. Other than that, we're going to go and perform our dental. The second radiograph I'm going to take, I'm going to do a back molar. I got my gauze in place, my plate on, and I have this ready and set up. So we're going to go ahead and do our exposure and pause. We're going to do a small dog. We're going to do, I want the molar. Okay, ready and exposed. Perfect. So on our second dental radiograph that we took on the molar, there's just, to me, some gingival recession and some periodontal pockets starting to fill, but we have periodontal filler to put inside of them. And once we actually start the dental and get in there, we'll know exactly what we're working with. Hand scale this dog's canine tooth. You want to make sure to hold your scaler flat against the tooth. Try to get underneath the gum line. And make sure that you get in between the teeth as well. So some of it just comes off with a little bit of pressure. And it's obviously way better with an ultrasonic scaler. It's very important to always make sure that you open a brand new prophy angle to put onto your polisher before you start polishing. After ultra scaling, you're going to use your prophy paste to go ahead and polish the teeth. I make sure that nobody contaminates this. Some people have little rings where they can dip it in and get it out. the whole entire tub, whatever works. So once you use the ultrascaler, it kind of scratches up the tooth surface. So the point of polishing is to fill in all of those scratches that you just did. And then so we're going to go ahead and fill. And get the whole tooth. Kind of massage it really good. And get that underneath. Back of the tooth. You just want to go there and get every single tooth. Because plaque builds up faster in those scratches and those grooves. And your patient will be coming back for a dental. Another one. You get done, you're going to rinse off all of that Profi paste and then air dry it. And then we have a nice, pretty white smile. And then we also use this fluoride preventative treatment gel to rub onto the teeth afterwards, and it makes their breath smell extra fresh. Okay, Stumpy's ready to go home. Super sweet, here you go. Okay, so a few things to go over. Stumpy was a grade 2 dental, which isn't too bad. Due to him being under anesthesia, we're going to go ahead and restrict his activity for a little while. His blood work turned out perfectly fine. And I can give you copies of that. He had no teeth extracted. However, if I were to extract teeth, he would have had canned food and dry food with warm water, and no chewing on hard bones or toys for about 2 to 3 weeks. He got an antibiotic injection and a pain injection, so that's good. If we were to extract teeth, we would have sent pain medication home with him. For future dental care, I have some information here about future dental forms and stuff. We have things called like CET shoes and Oravet, which are just shoes that somebody can just chew on at home, kind of like a treat, and it kind of knocks all that plaque off his teeth, and that helps reduce the plaque buildup and having it come in all the time and bad breath. So I'm sure that helps. If you can, we always recommend brushing his teeth if that's possible. It doesn't replace a dental, but it does help out a lot. So we still need to do the annual or biannual dental care. And because he's a smaller dog, we recommend doing it biannually, and also getting his blood work done because that helps give us something back to look on. I do have some before and after pictures and his radiographs and his dental chart, so that all can be sent home with you. And you can call us if you have any questions, and here's our emergency number.
Okay. Thank you.